My guest today is Brad Greer. He's CEO of the company DryC, which is a medical technology company dedicated to improving wound care. And I'm so glad to be talking with him because one of the most vexing challenges we have as family caregivers is dealing with wound care. Your loved one has surgery, comes home from the hospital, don't get it wet, use saran wrap, get a plastic bag, come back in 4 days, but whatever you do, it's just nonsensical what we're supposed to do. And it's lovely that somebody is finally addressing the issue of wound care integrity. Brad, tell me what challenges that DryC is dedicated to solving for family caregivers.
We're dedicated to helping wound healing. Our technology is the only patented technology of its kind in the world. That is a waterproof dressing with liquid indication technology. So it's about self-care, whether you're an elder or an elderly person or deployed as a military person. You know when to change your bandage with DryC because of the color change, whether that comes from wound exudate or showering and bathing. And I might add, there are 2 studies that say that showering reduces stress, and reduced stress does promote wound healing.
Oh, that's interesting. So in a sense, you have to avoid the thing that helps you reduce stress unless you have, the DryC working for you, because, and I've been there, everyone's been there. It's not really effective to use the plastic bag and the saran wrap and whatever. You just give up on the showering, and nobody doesn't want to shower for 4, 5, 6 days.
Yeah, that goes for the patient and the caregiver, because they would like their patient to shower.
Oh yeah, I think so. How does DryC work? I know everyone's interested now in figuring out how not only how effective it is, but how does it manifest itself?
The DryC product is virtually identical to the waterproof 3M Tegaderm, except that we have liquid indication technology. So you see it blue here. When you place it on your arm or leg or back, it's white. And if there's leakage from showering and bathing and this perimeter band changes to blue, you're okay. But if the wound pad also changes blue from showering, bathing, or wound exudate, then you know to change your bandage. So you're not swapping out 3 or 4 of these products a day. You can wear this product for 3, 4 days and shower every day.
What kind of wounds do you find DryC to be effective for?
Small incision surgeries like hernias, but even back and hip procedures. Our daughter had ACL surgery in August, and she had 3 incisions. So the 5x10 size of the DryC worked for her for showering. This product is less useful for chronic wounds, diabetics that have wounds that are very, very hard to heal. However, we have a foam product that we're making samples of now that will address the needs of chronic patients. So this is more what you would call an acute wound product.
What sizes does it come in?
2x2. This is the 4x4. You can see this on our website, and we have a 5x10 size.
So we talked about this a little bit, but I want to dig into what is a liquid intrusion alert?
Right. So both of these products have a wound pad. We have a wound pad and a perimeter band with the liquid indication technology. And it's literally woven into the wound pad and the perimeter band. That's the special technology, the patented technology that we have. And we manufacture it at scale with our manufacturing partner.
Talk to me about cost, compliance, and callback.
Payers, insurance companies, or Medicare will pay for 3 of these a week in a hospital setting or skilled nursing setting. And then a patient may go through 3 or 4 of these a day because it looks exactly the same, saturated, wet, and dry. With DryC, again, it'll last 3, 4, sometimes even 5 days, and showering every day or even swimming. So cost. 2 is compliance. Patient compliance increases. Why? Because they know when to change their dressing. And the patient knows this. They don't have to call or FaceTime a caregiver to ask whether or not they need to change their bandage or dressing. That's compliance. And we've talked about cost. Callbacks, number 3 is because patient compliance increases, because the patient and the caregiver know when to change their bandage and dressing, that results in fewer callbacks to caregivers, nurses, and doctors.
It helps us as patients, as care receivers, or as caregiver, family caregivers, to be more self-reliant.
It very much does. It very much does. And again, the example is if you're in a military setting, you can't go to the clinic on your aircraft carrier 4 times a day. Do I need to change my bandage? Well, that military personnel knows when to change their bandage or dressing.
How did you come up with DryC?
Well, it's a great story. Actually, a oncologist professional here in Houston came to our founder chairman, who's an inventor, and said, here's a problem. My chemotherapy patients can't shower for 2 weeks or 1 week when they're receiving treatment. And that's because there was no bandage or device that they could put over their chemo port and tell them when it's compromised, contaminated, and they need to change the dressing. So the idea was there, and it took our chairman, founder, about 1.5 years to perfect this simply elegant technology before we patented it.
How does it differ for a caregiver to use DryC as opposed to any other product?
You know, our chairman, for example, his father is in a assisted living center for Alzheimer's. Let's say he has a wound.
Yeah.
It's a wound on his leg. Well, that caregiver does not have to go to Mr. Mayfield's room once every 45 minutes or once an hour to assess that bandage or dressing to see if it needs changed. Because the patient knows when it needs to be changed, and it results in more efficiency and frees up that caregiver to address more urgent or at least different needs.
How do we get DryC?
Well, you can go to DryC.com. If you're in the military, we're on contract with the military and the VA system. You can also go to Amazon. Amazon is the easiest way to buy DryC via Amazon Prime.
I think it's great. I love to talk to innovators who are making the lives of family caregivers better. And I really appreciate I know how busy you are, so I really appreciate your time. And thank you for all you guys are doing at DryC. Keep doing it.